गुड मॉर्निंग स्टूडेंट। आज इस वीडियो लेक्चर में हम रिवीजन क्लास करेंगे। तो हम सोशल फार्मेसी से ही स्टार्ट करेंगे। तो सबसे पहले हम पढ़ते हैं एक्सटेम्पोरेनेस डिस्पेंसिंग के बारे में। An extemporaneous preparation is a drug specially prepared by pharmacists because an appropriate drug is not readily available. Extemporary dispensing is the process of compounding ingredients to prepare a medicine for an individual patient. It is also an on-demand preparation and dispensing of a drug product according to a physician's prescription. It involves mixture of powdered active ingredients with a diluent powder and filling a great a given number of capsules or other suitable dosage form. As temporary compounding requires equipment for weighing, measuring, and compounding. Some common equipments are balances, forceps, and spatula, pistons and motors, graduates and pipettes, master formula sheet. Guidelines for extemporaneous compounding. Pharmacists should provide according to the physician's prescription to the individual patient. Dilution and mixing of active ingredients with other ingredients should be done in definite proportion according to master formula sheet. Conversion of solid dosage form to solution or suspension as per the prescription. All the ingredients should be within the expiry date. All the equipment used for compounding should be clean and dry. Products should be labeled clearly and stored in suitable place as recommended. Compounding should be in accordance with good manufacturing practice. Guidelines for extemporary dispensing. Pharmacists should consider extemporaneous dispensing only if no commercial product exists and should be according to the physician's prescription. Extemporaneous preparation to be dispensed should not exceed 1 month even if the shelf life is more than 30 days. Proper labeling is required and storage should be done in a suitable container as recommended provide direction to the caregiver about the administration of medication. Example of extemporary dispensing. Generic name allopurinol. Indication gout or uric acid and calcium oxalate renal stone. Dosage from suspension 10 to 20 mg per ml. Stability 30 days. Storage refrigerate or store at room temperature. Protect from light. Procedure. Crush tablet in mortar to fine powder. Navigate the powder with small amount of vehicle until a smooth paste is formed. Add more vehicle to the paste until a liquid is formed and transfer the liquid into the container. Use additional vehicle to rinse the remaining drug from the mortar and pour into the container. Make up to final volume with vehicle, shake well and label. Scope and importance of extemporaneous compounding helpful for individual patients that require diluted strength. Example, pediatric patients useful if dose conversion from solid oral dose to solution or suspension is required. Patients sensitive to certain compounds like dyes, preservatives, flavors can use extemporaneous compounding. Dermatological formulation with strength or diluted concentration can be compounded for commercially available products. Labeling of dispensed products. A label is an written information about the product attached to a container with medicine to be dispensed. Information on label includes product name, strength, and quantity, storage conditions, and shelf life. Information to the patient. Labeling of the pharmaceutical product. Types of labels. Patient label, stock label. It is a label prepared during dispensing. It includes name, amount, indication, dose of medicine, name of patient. It should be easily understandable and simple in language. Stock label. It is a label prepared by the manufacturer or pharmaceutical company. Information related to the medicine is mentioned in stock label. The information on the label should be accurate, label should be checked before fixing to the container, legible, label should be easily readable in written or printed form, intangible, adequate and relevant, proper and important information should be mentioned on the label, avoiding too much description. Information on the label for dispensed medicine. Name and address of the patient. Name and address of the supplier and the date of supply. Name, strength, and quantity of medicine. storage conditions, and shelf life of the product. Instructions to the patient. Example directions take when take with water, etc. Next is patient counseling. तो patient counseling is defined as providing medicine information orally or in written form to the patient or their representative on direction of use, advice on side effects, precautions, storage, diet, and lifestyle modifications. The process provides for the exchange of information between the patient and health practitioner. Why patient counseling is required? Patient counseling is important for new and refill prescriptions. Ideally, patient counseling will vary among individual patients according to their needs. Patients receiving more than a specified number of medications. Patients with visual, hearing, or literacy problems. Pediatric patients. Patients on anticoagulants. Method of patient counseling. Introduction. Pharmacist should review the patient record before counseling. Appropriate counseling includes information along with precautions, contraindications, and warnings. Inform patient on possible food drug interaction and adverse drug reaction. Counseling content items. Discuss the name and indication of the medicine